I think one of the most important things that family, friends, caregivers can do to help a patient is to be honest, to be genuine, and to ask the patient what they need. And it might be, I need you to leave me alone, you know, but it might be, I need you to bring chicken soup. I need you to take care of my son or daughter for the afternoon. I need you just to sit and listen while I cry. I'll be okay, I just need to cry right now. But they need to be genuine and honest in their approach. They need to know that cancer isn't contagious, you know, that they're not going to catch it by talking to somebody, that cancer patients need love too. So they need to be honest and genuine and really ask the patient what they need. And conversely, the patient has to be open enough to be genuine and honest and to be honest about what their needs are and to communicate that in a forthright and appropriate manner. I think husbands, loved ones will have a hard time dealing with breast cancer unilaterally. I think it's impossible to care about somebody and not be impacted by the diagnosis of cancer. I think that some people just deal with that better than others. Some people because of their own family history, are too scared to deal with their loved one's disease, and consequently they shut themselves off. A lot of caregivers and loved ones don't want to acknowledge their feelings because they feel they don't want to burden the cancer patient. And that in turn, the cancer patient says, oh my God, they don't care. So there's this giant elephant in the living room and nobody's talking about it. So it's like the caregiver doesn't want to burden the patient with their feelings. The patient doesn't want to feel like more of a burden because they're already asking for logistical, transportation, financial help. So they don't want to burden them, and it just keeps compounding. So one of the things that I help people do, or I try to help people do, is to start talking about those very basic fears, their concerns, the fact that they don't want to be a burden. So it's surprising that a lot of husbands feel very guilty about their feelings and don't want to share that with their loved ones.
That's kind of a male trait, though, isn't it?
And female. It's just, it is the nature of a disease state that causes that. Because I've seen that in same-sex couples as well, where the caregiver doesn't want to burden the patient with their fears and their worries. They have enough going on, but at the same time, they're depriving their loved one of knowing how much they care. It's kind of a conundrum. You have to do that balancing act of, I can share it and I don't have to overwhelm them with this, but it's important that they know.
What do you recommend for a caregiver, a husband or a caregiver then?
To be genuine, to not be overly dramatic, to cry with the patient, really appropriate, but also to be informed, to help understand when the couples that I've known that have done the best is the couple, the caregiver, the husband or the partner who is able to help the patient and say, you know what, I'm scared too, but this is what we know. You're getting the best treatment we can give. And it's important that we not let cancer own us.
And I think it's important that husbands and caregivers say, and we're going through this together. Do you?
Yeah, absolutely. Cancer is not an isolated event. It does not exist in a vacuum. It impacts the entire family system. And the family system can be the loved one, it can be the parent, it can be the child. It can even be those people that are close enough to us that we consider family of affiliation. And it takes all of those to be in that together, rather than just the loved one. Everybody, it impacts everybody. I often liken having a cancer diagnosis to throwing a big stone into a little pond. It creates giant ripples, and those ripples spread outward. So, to say it doesn't, I deal with a lot of families, and the kids will come in here and they'll sit on the couch and I'm fine. And that lasts about 3.5 minutes before they're crying and saying, I'm so scared. And it affects everybody. And to not acknowledge that is a lot more work than to acknowledge it and to work as a team to get through it.